Fast pass metabolism. As a consequence, absorption is frequently incomplete following oral administration. The term bioavailability describes the proportion of the dose that reaches the systemic circulation intact. Buccal and sublingual SL. These routes have the advantage of enabling rapid absorption into the systemic circulation without the uncertainties associated with oral administration. Example, organic nitrates for angina pectoris, triptans for migraine, opioids analgesics. Rectal PR. The rectal mucosa is occasionally used as a site of drug administration when the oral route is compromised because of nausea and vomiting or unconsciousness. Example, diazepam in status epilepticus. Parenteral administration. These routes avoid absorption via the gastrointestinal tract and fast metabolism in the liver. Intravenous IV. The IV route enables all of a dose to enter the systemic circulation reliably without any concerns about absorption or fast metabolism. Example, the dose is 100% bioavailable and rapidly achieve a high plasma concentration. It is ideal for very ill patients when a rapid certain effect is critical to outcome. Example, benzyl penicillin for meningococcal meningitis. Intramuscular IM. IM administration is easier to achieve than the IV route. Example, adrenaline or epinephrine for acute anaphylaxis. But absorption is less predictable and depends on muscle blood flow. Subcutaneous SC. The SC route is ideal for drugs that have to be administered parenterally because of low oral bioavailability, are absorbed well from subcutaneous fat, and can ideally be injected by patients themselves. Example, insulin, heparin. Transdermal. A transdermal patch can enable a drug to be absorbed through the skin and into the circulation. Example, estrogens, nicotine, nitrates. Nasal. The nasal mucosa provides another potential route for absorption of some drugs with systemic action. Example, sumatriptan, calcitonin, naloxone, testosterone, desmopressin. Other routes of administration. Topical application of a drug involves direct administration to the site of action. Example is skin, eye, ear. This has the advantage of achieving sufficient concentration at this site while minimizing systemic exposure and the risk of adverse effects elsewhere. Inhaled INH administration allows drugs to be delivered directly to a target in the respiratory tree, usually the small airways. Example, salbutamol, beclomethasone. However, a significant proportion of the inhaled dose may be absorbed from the lung or is swallowed and can reach the systemic circulation. The most common mode of delivery is the metered dose inhaler, but its success depends on some degree of manual dexterity and timing. See figure 17.223. Patients who find this difficult may use a spacer device to improve drug delivery. A special mode of inhaled delivery is via a nebulized solution created by using pressurized oxygen or air to break up solutions and suspensions into small aerosol droplets that can be directly inhaled from the mouthpiece of the device. Drug distribution. Distribution is the process by which drug molecules transfer between the circulating blood, interstitial space and intracellular fluid. This is influenced by the drug's molecular size and lipid solubility. The extent to which it binds to proteins in plasma is susceptibility to drug transporters expressed on cell surface and its binding to its molecular target and to other cellular proteins which can be irreversible. Most drugs diffuse passively across capillary walls down a concentration gradient into the interstitial fluid until the concentration of free drug molecules in the interstitial fluid is equal to that in the plasma. As drug molecules in the blood are removed by metabolism or excretion, the plasma concentration falls and drug molecules diffuse back from the tissue compartment into the blood until eventually all are eliminated. Note that this reverse movement of drug away from the tissues will be prevented if further drug doses are administered and absorbed into the plasma. Volume of distribution. The apparent volume of distribution (VD) is the volume into which a drug appears to have distributed following intravenous injection. It is calculated from the equation VD equal D.C0, where D is the amount of drug given and C0 is the initial plasma concentration, figure 2.4a. Drugs that are highly bound to plasma proteins may have a VD below 10 liter, example warfarin, aspirin, while those that diffuse into the interstitial fluid but do not enter cells because they have low lipid solubility may have a VD between 10 and 30 liter, example gentamicin, amoxicillin. It is a apparent volume because those drugs that are lipid soluble and highly tissue bound may have a VD of greater than 100 liter. Example digoxin, amitriptyline. Drugs with a larger VD have longer half-lives, take longer to reach steady state on repeated administration, and are eliminated more slowly from the body following discontinuation. Drug elimination, drug metabolism. Metabolism is the process by which drugs are chemically altered from a lipid soluble form suitable for absorption and distribution to a more water soluble form that is necessary for excretion. Some drugs known as prodrugs are inactive in the form in which they are administered but are converted to an active metabolite in vivo. Figure 2.3, Pharmacokinetic summary. Most drugs are taken orally, are absorbed from the intestinal lumen, and enter the portal venous system to be conveyed to the liver, where they may be subject to fast metabolism and or excretion in bile. Active drugs then enter the systemic circulation from which they may diffuse or sometimes be actively transported in and out of the interstitial and intracellular fluid compartments. Drug that remains in the circulating plasma is subject to liver metabolism and renal excretion. Drugs excreted in bile may be reabsorbed, creating an enterohepatic circulation. Fast metabolism in the liver is avoided if drugs are administered via the buccal or rectal mucosa or parenterally, example by intravenous injection. Oral, buccal, mouth, stomach, small intestine, large intestine, rectum, rectal, excretion in feces. Metabolism, intestinal wall enzymes, liver enzymes. Parenteral, circulating plasma, kidney, excretion in urine, liver. Intracellular fluid, interstitial fluid.